All right, today we're going to crack open the incredible world of medical diagnosis. And let me tell you, this isn't about just memorizing facts from a textbook. This is pure, high-stakes investigation. It's like solving a puzzle where every single piece, every clue, can be the one thing that turns mystery into a clear answer. And really, this is the whole idea right here. Every patient walks in with a collection of symptoms, a personal history, a whole set of mysteries, and it's the doctor's job to be the detective, to piece it all together. To see how it works, you're going to step into that role. We've got 2 real cases to solve, and we're starting right now.
Okay, so our first investigation is the fever mystery. The case file just hit our desk. Let's open it up and see what we're dealing with.
So here's our guy, a 35-year-old man who's been feeling sick for about 2 weeks. The first things he mentions are pretty vague, but they're not going away. He's tired, he's losing weight without trying, and he's got this fever that just won't break. This is our starting point. As we dig in, the clues start to form a real pattern. You've got that persistent, low-grade fever. He's waking up drenched in sweat at night. He's lost a lot of weight. We also find swollen lymph nodes all over his body, a nagging cough, and, now this is really important, a history of having had tuberculosis in the past. Every single one of these is a vital piece of the puzzle. Now, those first 3 clues we mentioned, the fever, the night sweats, and the weight loss, they are so important together that they actually have a nickname in medicine. B symptoms. And when a doctor sees this classic trio, let me tell you, major alarm bells start ringing. It points to something big, something systemic happening in the body.
So with those B symptoms and the swollen lymph nodes, we can now draw up our lineup of the prime suspects. I mean, could his old tuberculosis be back? Are we looking at a type of cancer, like a lymphoma? Or maybe some kind of inflammatory condition? At this stage, everything has to be on the table.
Okay, so let's pause. You're the detective, you've seen the evidence, the classic B symptoms, the widespread swollen nodes, the patient's history. What's your gut telling you? Which of these suspects is the most likely culprit?
If you guessed Hodgkin's lymphoma, you are absolutely correct. It fits the clinical picture almost perfectly, making it our #1 suspect. But you know, a good detective doesn't just find the right suspect. They have to prove why everyone else is innocent. What about a TB relapse? Well, his chest x-ray was completely clear. Sarcoidosis and leukemia? They just have different classic presentations that didn't match the evidence we had. Those B symptoms made Hodgkin's the textbook fit. Case 1, closed.
All right, time for our second case. And this one is completely different. It's not a dramatic mystery of fevers and sweats, but one of a deep, unshakable exhaustion. Welcome to the fatigue puzzle.
So our new patient is a 25-year-old woman, and her main problem is just feeling tired all the time and getting winded doing simple things. Again, we're starting with a really common, non-specific complaint. As we listen to her story, a few more clues start to surface. We notice she's pretty pale. She mentions getting dizzy sometimes and having headaches. And then she drops this little tidbit, a family history of anemia. You know, that genetic clue could be a huge lead. Now, unlike our last case, the deciding evidence here isn't on an X-ray. It's right there in her blood. A simple blood test gives us pretty much everything we need to know. Her hemoglobin, which is the protein that carries oxygen, is low. Her MCV is low, which means her red blood cells are too small, and her levels of both iron and ferritin, which is basically the body's iron savings account, are both low. Let's just zoom in on this one number for a second, 9.5. For a woman her age, a normal hemoglobin level is 12 or even higher. So this number tells us one thing for sure, she has anemia. The question is no longer if she has it, but why. So that brings in a whole new lineup of suspects. All of these are different potential causes of anemia. Is it a straightforward iron deficiency or a genetic thing like thalassemia? The key is right there in the lab results. So take another look at that lab report. You've got small red blood cells, low iron, and this is the key, low stored iron. Which one of our suspects does that point to? Yep, the evidence is pretty overwhelming here. The diagnosis is iron deficiency anemia, which is actually the most common type of anemia in the whole world. And here's exactly how we can be so sure. That low ferritin, the body's iron stores, that's the smoking gun. See, in other types of anemia like thalassemia, ferritin is actually normal or even high. And something like a vitamin B12 deficiency, that causes the exact opposite problem. It makes red blood cells really big, not small. The evidence didn't just point us to the right answer, it actively ruled out all the others. Okay, let's zoom out. What have we actually learned from these two investigations? What's the secret sauce for cracking the diagnostic code every single time? I mean, think about it. We just solved a cancer case and an anemia case. One depended on physical science and images. The other was all about the numbers in a lab report. But even though the clues looked totally different, the detective's method was exactly the same.
And here it is. This is the universal playbook. It all starts by just listening, really listening, to the patient's story. Then you go out and gather your clues from exams and tests. You analyze all that evidence. You create your lineup of suspects, and you systematically rule them out until only one is left standing. And you've cracked the case. It's a powerful, logical method that you can use again and again. Of course, it's always worth remembering that getting the diagnosis is just the first step. I love this cheeky quote from Voltaire centuries ago. Identifying the problem is one thing, actually fixing it is a whole other ballgame. But you can't even begin to treat something until you know what it is, until you can give it a name. And that leaves us with this final thought. This whole process, this systematic, evidence-based way of solving a problem, it's not just for doctors. It's happening all around us, every day, in science and engineering, even in our own lives. It really makes you wonder, doesn't it? What other invisible puzzles are out there just waiting for a detective to come along and crack the code?